You have questions, we've got you covered. It's time for Ask the Doctors. And Kristen is in the audience with a question, and our friend and colleague, orthopedic surgeon, Dr. Levi Harrison, also joins us with some answers.
Absolutely.
All right,
Absolutely.
so Kristen, welcome. Thank you for coming. What's your question?
So I'm 6 months pregnant, and
Congratulations.
I'm experiencing major back pain. So I've been an athlete most of my life, and I've used kinesiology tape in the past. But my question is it safe to use during pregnancy?
It is a tough situation because it makes patients so uncomfortable. And I know you've probably done things like the maternity belts and the big pillows and all of those things. And so once we kind of go through the normal things people do, then sometimes they'll try to think about other options such as this.
Yeah, well, I love the fact that during pregnancy you can use kinesiology tape. This is a type of tape that I use often in my practice for women who come in with issues of gestational carpal tunnel. I'll tape their wrists. Yeah. We can also use it for their lower back. The great thing about the tape, it can be used for pain, for postural alignment and instability, for joint rehabilitation, as well as soft tissue rehabilitation. I've used it effectively for many, many years. I'm a fan.
Dr. Levi, we've been doing this show over 10 years, and I don't think we've ever really taken an in-depth look at kinesiology tape. So what is the physiology? How does it work?
The tape has a lot of great benefits that I like. Number one, it can really help with pain relief, I find. Now, the science of how it works, the studies are not the highest power, so not a lot of people involved, and the studies haven't been replicated yet. However, overall, the thoughts are the following. One, it helps to decrease pain in a certain area, because when you place the tape, you can increase the interstitial space, therefore decreasing the amount of pressure on pain receptors. Number two, if you decrease pain, well, hopefully you increase blood flow, therefore decreasing inflammation in the area. And thirdly, lymphatic flow. If you can increase lymph flow, then you can also increase inflammation. So it has a lot of benefits that we think can help. However, I think the science has not caught up with the tape yet. So I still like the tape. I've used it for years as an athlete, as a physician. I've used it on my patients, on celebrities, on trainers. I think it has a benefit for a specific purpose.
But this isn't the same as athletic tape, though. This is different.
It's a little different.
This is different.
Have you seen this used in pregnancy? Is it used for support, or in what context?
Well, I've used it in my practice for lower back pain for pregnant individuals very often.
Okay.
You know, even as an orthopedic surgeon, I still see women who have back pain, who have carpal tunnel syndrome, gestational carpal tunnel, which we think might have a correlation with gestational weight gain, for example. And even those studies are not crystal clear. So I've used it in my practice for them as well as for athletes. And for Kristen, I bet she has been an athlete most of her life, I bet. You know, often the tape is effective, so I use it.
So what about the belly area, though?
Well, that's a great question. I would not, as an orthopedic surgeon, as a physician, I would not use it on the belly of a pregnant woman. I would not, and I think for yourself as an obstetrician gynecologist, I don't think you would vote for that either.
Right, so that's why I said we typically kind of do the other things, and then we'll move to the kinesiology tape. Because
I think some people are posting that kind of thing on the internet, aren't they?
Well, just with pregnancy, we always want to see good randomized controlled trials because we're trying to protect those babies.
Absolutely.
Right.
Yeah.